In today's challenging healthcare environment, patients, employees, caregivers, and visitors expect a positive and consistent experience. Yet oftentimes, different service delivery models related to dining and environmental services exist within the same hospital or health system. Systemness, or the ability to provide a consistent experience for all stakeholders, has become a priority as healthcare providers look to create environments and processes for greater continuity across their facilities. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter for AHA. Join us to hear the story of how Indiana University Health was able to achieve and deliver on a successful, scalable model of Systemness to elevate the service delivery experience for patients, staff, and visitors. Learn how it leveraged an aligned mobilization process and streamlined the transition of dining and environmental services to ultimately deliver program consistency, service excellence, and stakeholder satisfaction. Today's podcast is brought to you by Aramark.
Good day. I'm Bob Kehoe, Content Manager with the AHA Center for Health Innovation. With me today are Matthew Simpson, Vice President of System Support Services with Indiana University Health, and Curtis Correll, Vice President of Operations with Aramark. Let me start with you, Matthew. Can you please explain the concept of systemness in healthcare today and what makes it a priority for healthcare executives?
Sure, Bob. Like many health systems, IU Health has grown over time by joining with other hospitals located in the communities we serve. And while some aspects of the care delivery model, computer systems, and other shared services have already been standardized across those facilities, there are still some functions that continue to be managed locally. And this could lead to variation in patient experience, quality, inefficiencies, and sometimes underinvestment in equipment and capabilities. So Systemness aims to identify those functions and design a new standard approach, ideally as close to leading practice as possible. The goal of such an effort ultimately is to improve service levels, create consistent patient and team member experiences, and build a foundation that can then be managed and improved upon in a consistent way from a system perspective. By designating a system leader over those services, we have someone who prioritizes those teams and their results on a daily basis without having as many local competing priorities. Our hope is that level of attention allows us to have better outcomes than we otherwise would.
So often when a healthcare system starts down the path towards systemness, the focus is primarily on cost benefits. But the process delivers more than just cost efficiencies. What other components of a systemness strategy did you assess, and what additional benefits did you evaluate in the decision-making process?
For the areas we have focused on over the last 18 months, food and environmental services and healthcare technology management, cost benefits were actually towards the bottom on the list of priorities. While we certainly plan on getting more efficient and driving improvements in these programs, our motivations for food and environmental services were first to establish a system approach with consistent structure, leading practices, and performance management. Second, creating high quality experiences for our patients and team members. Third, improving service levels. And lastly, stewarding resources well. One important benefit we realized just in time for our COVID response is the ability to respond in unison to the dynamic needs of other teams like infection prevention, nursing, supply chain. We were able to have a single system representative and contact for input, decision making, and communication, which would not have been possible otherwise.
What steps or considerations were taken to ensure success?
Bob, I feel very strongly about our three-tiered approach, which we feel matched directly with the IU Health Way. And that was a people first, seek to understand, and a slow and steady approach towards our transition. For people first, we partnered with IU Health on stabilizing the workforce, informing them and keeping the people whole. We didn't want decisions we were making as a system to negatively impact anyone's pay, retirement, bonuses, tenure, etc. And we tried to be as transparent through that process as completely possible with those employees that were impacted. As far as seek to understand, we felt together that you have to understand how an organization works currently in order to change its direction with the knowledge of why they operate like they do now. And lastly, our slow and steady approach. We work together to map out current state of operations and the steps and change needed to occur with some timelines in order to get to our agreed upon goals. We communicated these changes to the key stakeholders.
In addition to making sure that we were looking at how we were impacting our team members, we committed early on to being present and rounding with the teams. We wanted to stay visible. And we made this about how we could support the teams to make sure that they had the resources they need, not taking away accountability or resources, but really empowering them and providing them with the tools that they need to be successful. Lastly, kind of transitioning away from the focus on the people and the change management, we had to set up some system governance structure with decision-making processes, connectivity to regional leadership, and then establishing local and regional and system operating reviews and escalation paths so that we had a structure to operate under. We couldn't just tear down an old approach and an old model. We had to build a new one that we could work with.
What were the critical elements in your strategy development that would be helpful for other systems to consider as they work through similar issues and strategies?
I think one general one is to do some self-evaluation of your organization and remember that you're on a journey. While there are times where I would have liked for us to progress or change more quickly or be a little bit more prescriptive in how we were designing processes and what the future state would look like, I think it's important for systems to evaluate how much change their people and processes can withstand in a given time period.
Great. Curtis, did you have anything to add?
No, I think one of the things that Matthew and I learned on this journey was through 17 locations, there were 17 sites. And I think we were learning that on the fly. And I think to Matthew's point, that if an evaluation more critically could have been done, we could have probably implemented change a little more quickly. Again, taking in mind the employee impact of change. Well, Bob, as far as what Matthew and I would like to do differently, first is try not to transition 17 locations during a global pandemic. But all kidding aside, it has to be a partnership, together working towards the goal set. However, although we feel we've communicated together very well, we probably could have been more prescriptive with our discussions with the actual IU Health site leaders during what, for their perspective, was an unbelievably communicative time with staffing shortages, COVID spikes, ICU beds. We probably could have done a better job mapping out what change was going on for food and environmental services with those key leaders.
Yeah, I agree. I have a bias, just the way that I operate, towards putting in the heavy lifting on the front end. So that could look like doing a better job of more current state analysis, really developing that future state design, and then performing a gap analysis to help guide some adoption strategies. And in my experience, that early investment tends to pay dividends in the long run. As Kurt described, we were in a situation where we ended up having to build the plane a little bit while we were flying it. And there were a lot of competing priorities and other things going on simultaneously. I would also say, as Kurt mentioned, just over communicate. And we were trying to make space and create space for other initiatives and other communications to go out. And I think that resulted in potential breakdowns in communication in a couple spots. For the future of Systemness at IU Health, we still have progress we want to make in continuing to improve these services. And we also have a pipeline of other functions that are being evaluated. And this will be an ongoing process at IU Health.
Matthew and Curtis, thank you for joining us today and for sharing your insights and thoughts. If you'd like to learn more about Aramark, please visit healthcareinsights.aramark.com.